100 questions plus answers for competency test. Topic: Obstetrics and Gynecology. 1. A 32-week pregnant woman presents with painless bleeding. What is the most likely diagnosis? Answer: placenta previa. 2. A 24-year-old woman with acute lower right abdominal pain and a positive pregnancy test. What is the most likely diagnosis? Answer: ectopic pregnancy. 3. What are the diagnostic criteria for preeclampsia? Answer: hypertension is greater than or equal to 140/90ths of a millimeter of mercury after 20 weeks of gestation with proteinuria or signs of organ damage. 4. What is the primary indication for performing a cesarean section? Answer: fetal distress, dystocia, placenta previa, or breech presentation. 5. What is the initial step to manage shoulder dystocia? Answer: McRoberts maneuver. 6. A postpartum woman presents with fever, abdominal pain, and foul-smelling lochia. What is the most likely diagnosis? Answer: endometritis. 7. A woman with chronic hypertension presents with severe headache and blurred vision. What is the diagnosis? Answer: severe preeclampsia. 8. What is the first-line treatment for eclampsia? Answer: magnesium sulfate. 9. A woman with 6 weeks of amenorrhea and spotting. Ultrasound shows a gestational sac without an embryo. What is the diagnosis? Answer: an embryonic pregnancy. 10. What is the screening test for cervical cancer? Answer: pap smear test. 11. What is the main complication of placenta accreta? Answer: massive postpartum hemorrhage. 12. What is the most common cause of primary postpartum hemorrhage? Answer: uterine atony. 13. A woman with irregular menstrual cycles, hirsutism, and insulin resistance. What is the most likely diagnosis? Answer: polycystic ovary syndrome, PCOS. 14. A 55-year-old woman with postmenopausal bleeding. What diagnostic step should be taken? Answer: transvaginal ultrasound and endometrial biopsy. 15. What is the main risk factor for placental abruption? Answer: maternal hypertension and abdominal trauma. 16. A woman with fishy smelling vaginal discharge and a positive whiff test. What is the diagnosis? Answer: bacterial vaginosis. 17. What is the first-line antibiotic treatment for pelvic inflammatory disease, PID? Answer: ceftriaxone and doxycycline. 18. A 35-year-old woman with chronic pelvic pain and dysmenorrhea. What is the diagnosis? Answer: endometriosis. 19. What is the characteristic ultrasound finding in a molar pregnancy? Answer: snowstorm appearance. 20. What is the primary purpose of administering Rh immunoglobulin? Answer: to prevent Rh-ISA immunization in Rh-negative mothers. 21. A woman in labor with inadequate uterine contractions. What is the first step? Answer: augmentation with oxytocin. 22. A 50-year-old woman with a unilateral ovarian enlargement on ultrasound. What is the suspected diagnosis? Answer: ovarian cancer. 23. What is the most effective contraceptive method? Answer: implantable contraceptives or intrauterine devices, IUDs. 24. A pregnant woman experiences premature rupture of membranes, PROM, before 37 weeks of gestation. What complications should be monitored? Answer: infection and preterm labor. 25. What is the primary indication for performing an episiotomy? Answer: risk of high-grade perineal tear or instrumental delivery. 26. A pregnant woman presents with severe pruritus and elevated bile acid levels. What is the diagnosis? Answer: intrahepatic cholestasis of pregnancy. 27. A woman with an abdominal mass and elevated California 125. What is the suspected diagnosis? Answer: epithelial ovarian cancer. 28. What is the hallmark sign of umbilical cord prolapse? Answer: fetal heart rate deceleration or bradycardia. 29. A woman presents with sudden pelvic pain and an enlarged ovary on ultrasound. What is the diagnosis? Answer: ovarian torsion. 30. What is the most common cause of first trimester bleeding? Answer: spontaneous abortion. 31. What is the main contraindication for combined oral contraceptive pills? Answer: history of venous thromboembolism or active breast cancer. 32. What is the primary treatment for hypothyroidism in pregnancy? Answer: levothyroxine. 33. A woman experiences uterine rupture during labor. What is the immediate action? Answer: emergency cesarean section. 34. What is the main treatment for gestational diabetes? Answer: blood sugar control with diet, exercise, and insulin if needed. 35. A woman with an open cervix and passage of tissue at 12 weeks of pregnancy. What is the diagnosis? Answer: incomplete abortion. 36. What is the first step in managing severe postpartum hemorrhage? Answer: uterine compression and administration of oxytocin. 37. What is the most common cause of infertility in women? Answer: polycystic ovary syndrome, PCOS. 38. What is the screening test for Group B streptococcus infection in pregnancy? Answer: vaginal and rectal swabs at 35 to 37 weeks of gestation. 39. What are the signs of fetal distress on CTG? Answer: late decelerations, minimal variability, or fetal bradycardia. 40. A 60-year-old woman with pelvic organ prolapse. What non-surgical treatment can be provided? Answer: pessary placement. 41. What is the initial treatment for dysfunctional uterine bleeding in premenopausal women? Answer: hormonal therapy, combined estrogen-progestin. 42. A pregnant woman with severe anemia. What is the most common cause? Answer: iron deficiency. 43. A 40-year-old woman with heavy menstrual bleeding and fibroids on ultrasound. What is the appropriate management? Answer: myomectomy or uterine artery embolization. 44. What is the main complication of pregnancy with placenta previa? Answer: massive postpartum hemorrhage. 45. What is the primary cause of stress urinary incontinence in women? Answer: weakness of the pelvic floor muscles. 46. What is the main side effect of contraceptive implants? Answer: changes in menstrual patterns. 47. What is the purpose of administering corticosteroids in preterm pregnancy? Answer: to enhance fetal lung maturity. 48. A 45-year-old woman with hot flashes and amenorrhea. What is the diagnosis? Answer: menopause. 49. What is the first step in managing umbilical cord prolapse? Answer: reposition the cord and place the mother in Trendelenburg position. 50. A woman with gestational hypertension but no proteinuria. What is the appropriate management? Answer: monitor blood pressure and fetal status, and administer antihypertensives if needed. 51. A pregnant woman at 36 weeks gestation presents with high blood pressure, proteinuria, and edema. What is the diagnosis? Answer: preeclampsia. 52. What is the primary test to confirm an ectopic pregnancy? Answer: transvaginal ultrasound. 53. What is the main complication of placenta previa? Answer: antepartum hemorrhage. 54. A pregnant patient with a history of chronic hypertension. What is the antihypertensive drug of choice? Answer: methyldopa. 55. What is the classic sign of a molar pregnancy on ultrasound? Answer: snowstorm appearance. 56. A woman with irregular menstrual cycles and acne. What is the most likely diagnosis? Answer: polycystic ovary syndrome, PCOS. 57. What is the most common cause of postpartum hemorrhage? Answer: uterine atony. 58. What is the main indication for an emergency cesarean section? Answer: acute fetal distress. 59. What is the hallmark clinical sign of a ruptured ectopic pregnancy? Answer: severe abdominal pain, vaginal bleeding, and shock. 60. What is the primary treatment for dysfunctional uterine bleeding? Answer: hormonal therapy or dilation and curettage. 61. What are the clinical signs of hyperemesis gravidarum? Answer: excessive nausea and vomiting, dehydration, and ketonuria. 62. A pregnant mother with gestational diabetes. What is the target fasting glucose level? Answer: less than 95 milligrams per deciliter. 63. What is the primary screening test for cervical cancer? Answer: Pap smear test. 64. What is the most common cause of infertility in women? Answer: ovulation disorders. 65. A pregnant woman experiences premature rupture of membranes. What is the primary risk? Answer: intrauterine infection. 66. What is the definition of preterm labor? Answer: labor occurring before 37 weeks of gestation. 67. What drug is used to prevent seizures in severe preeclampsia? Answer: magnesium sulfate. 68. What is the initial management step for umbilical cord prolapse? Answer: reposition the mother into the knee-chest or Trendelenburg position. 69. What is the main complication of endometriosis? Answer: infertility and chronic pelvic pain. 70. A patient presents with pelvic pain and purulent vaginal discharge. What is the most likely diagnosis? Answer: pelvic inflammatory disease, PID. 71. What is the primary treatment for vaginal candidiasis? Answer: antifungal agents like fluconazole. 72. What is the main complication of multiple pregnancies? Answer: preterm labor. 73. What is the classic ultrasound sign of placenta accreta? Answer: placental penetration into the myometrium. 74. What is the primary cause of recurrent miscarriage? Answer: cervical insufficiency or genetic abnormalities. 75. What is the definition of primary amenorrhea? Answer: absence of menstruation by age 16 with normal secondary sexual development. 76. What is the classic clinical feature of placental abruption? Answer: vaginal bleeding with abdominal pain and a firm uterus. 77. What is the primary test to evaluate uterine fibroids? Answer: pelvic ultrasound. 78. What is the main complication of a third-degree uterine prolapse? Answer: ulceration of the protruding tissue. 79. What is the primary indication for antenatal steroid administration? Answer: risk of preterm labor before 34 weeks to enhance fetal lung maturity. 80. What is the primary treatment for early-stage cervical cancer? Answer: radical hysterectomy or radiation therapy. 81. What is the most common cause of menstrual pain, dysmenorrhea? Answer: endometriosis or excessive uterine contractions. 82. A woman presents with frothy greenish vaginal discharge and itching. What is the diagnosis? Answer: Vaginosis caused by Trichomonas vaginalis. 83. What is the initial action for shoulder dystocia during delivery? Answer: McRoberts maneuver and suprapubic pressure. 84. What is the main indication for intrauterine contraceptive device, IUD, placement? Answer: long-term contraception. 85. What is the primary complication of HELP syndrome? Answer: disseminated intravascular coagulation, DIC, and multi-organ failure. 86. What is the hallmark sign of uterine rupture? Answer: sudden abdominal pain, vaginal bleeding, and loss of fetal heart tones. 87. What is the main treatment for prolactinoma with infertility? Answer: bromocriptine or cabergoline. 88. What is the definition of polymenorrhea? Answer: menstrual cycles shorter than 21 days. 89. What are the classic signs of advanced ovarian cancer? Answer: abdominal distension and ascites. 90. What is the primary treatment for a complete molar pregnancy? Answer: uterine evacuation and HCG monitoring. 91. What is the definition of postpartum blues? Answer: mild sadness occurring within the first 2 weeks postpartum. 92. What is the main cause of implantation bleeding? Answer: attachment of the blastocyst to the endometrial wall. 93. What is the primary complication of ovarian hyperstimulation syndrome? Answer: ascites, pleural effusion, and renal impairment. 94. What is the hallmark sign of a non-viable pregnancy? Answer: absence of fetal cardiac activity on ultrasound. 95. What is the main treatment for endometrial hyperplasia without atypia? Answer: oral or intrauterine progesterone. 96. What is the definition of secondary infertility? Answer: inability to conceive after previously having a child. 97. What is the primary indication for oxytocin use during labor? Answer: uterine inertia or to accelerate labor. 98. What is the main complication of forceps-assisted delivery? Answer: trauma to the baby's head or maternal tissues. 99. What is the primary cause of chronic pelvic pain in women? Answer: endometriosis or pelvic adhesions. 100. What is the initial management for a patient with eclampsia? Answer: administration of magnesium sulfate and labor stabilization.